Hi guys, so today we're with Nadia for her third polynucleotide treatment. We've already done 2 so far. We're going to talk about how your treatment's been so far, how you found it, and let's talk about sort of what you're looking to achieve with the polynucleotides under your eye.
What I was looking to achieve is I thought we could kind of get rid of the fine lines with Botox, and then you very rightly explained to me that that's not going to be fixed with that, and that polynucleotides is way more effective for like skin laxity and fine lines under the eyes. So we've done 2 sessions so far. In terms of pain, I would say it's really manageable, and I was most kind of scared about that, but that's totally fine. And you do get the tiny little dots, but as we were saying, it goes down within the first 24 hours mostly, and then within 48 hours completely. Which is great.
So we've already done a Botox treatment for Nadia around her eyes. A little bit of Botox just around the sides of her eyes here, because before that, when she had dynamic expression and she gave a big smile, we used to see some stronger lines here towards the sides of the eyes. So we've managed to deal with that with a little bit of Botox. What you see with Nadia under the eyes is just a little bit of skin laxity and really, really fine lines and wrinkles. They're not that visible, but if you look up close, you can see them. So what we're trying to achieve with the polynucleotides is by stimulating and injecting a little bit of polynucleotide just into the skin under the eyes here. We're going to hopefully see a nice tightening effect of the skin there, hopefully smoothing out those fine lines and wrinkles. Today is her 3rd session, so by the end of this you should see a visible improvement, but the results will continue to improve for 3 to 6 months afterwards. So we are now going to start, and we're going to do round 3 of polynucleotides. First thing we do is we pop on some numbing cream under the eyes. Now here we use 30% lidocaine, which is a really, really strong numbing cream in order to make this as comfortable as possible. So at New Clinic, we use the Chroma brand of polynucleotides. These are premium polynucleotides, and to give you an idea of the concentration of these, your Lumieyes, which is often quite a popular polynucleotide that's used, has 3 milligrams of polynucleotide per milliliter. These have 20, all right? So we're talking over 5 times the concentration of polynucleotides in comparison to Lumieyes. To make the experience much more comfortable for the patient is we actually use special needles. So the polynucleotides themselves come with a 30 gauge needle, which are these yellow ones here. And although these are adequate, they are still fairly thick. So what we do is we use special 33 gauge needles, which are one of the smallest possible needles you can use to inject polynucleotides. And if you see here how small that is absolutely tiny. You can hardly see the needle, which allows us to perform the procedure with a lot of comfort for the patient. Now finished Nadia's 3rd polynucleotide treatment. Okay, so just to let you guys know about the aftercare that's involved, there's 3 things we typically want to avoid after polynucleotides. Okay, so number 1 is exercise for 24 to 48 hours. Exercise is going to make any swelling worse. We want to reduce the blood flow going to the face. The 3rd thing is heat. So when I say heat, I mean things like saunas and steam rooms, okay? We don't want to make the swelling worse by applying heat to the body and to the face. And so avoiding saunas and steam rooms for 24 to 48 hours is what you want to do. And the 3rd one is alcohol, okay? Because alcohol is a vasodilator. It dilates the blood vessels, and when we inject anywhere in the skin, we've got a little bit of local inflammation there. So if we dilate the blood vessels, we're going to get some more swelling. So we want to avoid alcohol for 24 to 48 hours. We've also made little tiny holes in the skin with a needle, which means there's tiny little channels for bacteria to get into. So if we're going to touch that area of the face for the next 24 hours or so, just make sure your hands are super clean.
Cool.
Okay,
right.
That's it. All right guys, thanks for watching, and we'll keep you tuned for the next video.